Do you know that women have a biological clock? If you want to combat age-related infertility, do watch our video. Hi, I'm Dr Serene Lim. I'm an obstetrician and gynaecologist as well as a fertility specialist. I'm from SWC Serene Fertility and Women's Clinic at Gleneagles Medical Center. Egg freezing involves the extraction and storage of a woman's unfertilized eggs for future use. Egg freezing is a form of fertility preservation. Generally, there are two main reasons for choosing to freeze eggs. The first is what we call medical egg freezing, where a woman with a serious illness, for example cancer, wants to freeze her eggs because she has to go through chemotherapy or pelvic radiotherapy, which can potentially damage her eggs and cause early menopause. The second is what we call elective egg freezing. This is an option for women who wish to delay childbearing and combat age-related infertility. Women are very different from men. Men are able to produce sperm throughout their whole lives from puberty onwards, but women do have a biological clock. Every girl is born with a fixed number of eggs in her ovaries. This means that she's born with all the eggs she'll ever have in her whole life, and the egg counts can only go down with age. It's not just the egg count that goes down with time, but also the egg quality in terms of the genetic quality of the eggs with respect to the number of chromosomes. The average age of menopause is 51 years old. But what a lot of women do not realize is that about 10 years before menopause, many women already have low levels of infertility, not just because of low egg count, but also because of poor egg quality. A 30-year-old woman generally has about 75% of her eggs being genetically or chromosomally normal. This number goes down to 50% at the age of 35 and 25% at the age of 40. This means that a 40-year-old woman only has about 25% of her eggs being genetically normal. An abnormal egg has a lower chance of being able to be fertilized with sperm. Even if it does get fertilized with sperm, the fertilized egg is usually abnormal and it would not implant into the womb. Occasionally, some of these embryos do continue to develop, but they will stop developing and the pregnancy will end up in a miscarriage. Rarely, some of these abnormal embryos do develop into fetuses with genetic syndromes. So age-related infertility is not just related to infertility, but it also encompasses miscarriages as well as babies born with genetic syndromes. The egg freezing process is similar to what women go through for IVF. The difference is that in IVF, the eggs are fertilized with sperm and implanted into the womb to potentially get the woman pregnant. I usually tell my patients that going through egg freezing is like an exaggerated version of what we go through during our natural menstrual cycle. At any point of time in a natural menstrual cycle, most of the eggs in the ovaries are immature. In other words, they cannot be used for fertilization. In women with regular menstrual periods, at the start of their menstrual cycle, the brain produces signaling hormones to stimulate development of follicles or little sacs in the ovaries that contain eggs to develop to a mature stage and eventually ovulate. The brain usually produces enough signaling hormones to stimulate the development of only one and occasionally two follicles to the mature stage. But what we do for egg freezing is that we will give you these same signaling hormones but in much higher doses to stimulate the development of 10 to 20 follicles. This is what we call the ovarian stimulation phase of the egg freezing cycle, and it usually lasts for about 10 to 14 days. This is similar to the time it takes for a follicle to mature in a natural menstrual cycle. After the first phase, which is the ovarian stimulation phase, then your doctor will do what we call an egg retrieval procedure. This procedure is performed under sedation, so you will have no pain during the procedure. It usually lasts for about 15 to 20 minutes. Your doctor will insert a thin needle through the vagina to collect the eggs. So the whole procedure is done vaginally and there's no surgical incisions on the tummy. After the procedure, you may feel a little bit sore in the tummy, and this can usually be relieved by oral painkillers. After the eggs are retrieved, they are processed by the lab and prepared for freezing. There is no time limit on how long the eggs can be frozen. Once they are frozen in time. The main damage to the egg comes about from ice crystal formation at the time of freezing. But once they are frozen, the eggs do not change. The percentage of patients who return to use their frozen eggs varies with different centres and also among different countries. In Singapore, elective egg freezing was only legalised in July 2023, so we haven't seen many patients who have done elective egg freezing come back to use their frozen eggs. But in overseas centres, the return rate has been reported to be as high as 38%. 10 to 20% of patients who undergo egg freezing have a mild form of OHSS, where there is mild swelling of the abdomen as well as mild abdominal discomfort. This usually resolves by itself after a few days. About 1% of women may experience a severe form of OHSS where large amounts of fluid accumulate in the tummy as well as in the chest cavity. This can lead to dehydration, severe abdominal pain as well as breathlessness. These women would usually need hospitalization. Fortunately, the risk of OHSS has declined in recent years because of improvements in assisted reproductive technology. The other risks associated with egg freezing are very uncommon and they are related to complications that occur because of the egg collection procedure. These include bleeding, infection, and a very rare chance of bowel injury. The success rate of egg freezing is very much dependent on the number of eggs that we can get as well as the quality of eggs that we can get from the lady. These two factors depend very much on the age of the woman. For women up to the age of 37, you would generally need to freeze about 10 eggs to have a 50 to 70% chance of a baby. So egg freezing is not a guarantee, but I would consider it to be an extra opportunity where you are able to go back in time to conceive at a younger age when you were not able to.